Welcome to the Dr. Ramsey Show, sponsored by Revitalize Functional Medicine. If you're looking for health tips released consistently every week, you've showed up to the right place. We're grateful that you're joining us, and now your host, Dr. Teresa Ramsey.
Hi, and welcome back to the Dr. Ramsey Show. Today I have a long-term patient with me. He's going to share his experience seeing us, him and his whole family, his wife, his children, his stepchildren come to see us. And I just want to share with you what functional medicine looks like to a whole family. So welcome, Craig. Thank you for taking your time because I know you have a very busy schedule.
Oh, you're welcome.
And the fact
My
that you
pleasure.
took your time out to come in means the world to me.
Good. Thank you.
Thank you. So I know you've been coming, like you said, your daughter was the first one to come, Melissa. And then I think Carrie came in and you came. And so we were treating the whole family. Your both daughters and then your son, your stepson. What is it that made you bring your daughter to us to begin with?
So she had a twitchy stomach since the day she was born, had just always seemed to be having stomach aches and was having trouble. And no one seemed, traditional doctors didn't seem to have any suggestions at all. And so, we came to you, I think almost 10 years ago.
Yeah.
I think she was maybe 11 at the time.
Right.
And boy, it worked out really, really well.
And now look at Melissa. She's considering going to be pre-med
Yeah?
now, which is awesome.
Yeah.
She had called me just to ask me questions about, because I was in conventional medicine first as a nurse for 10 years. And then I found this career completely by accident, as I shared on one of the Dr. Ramsey shows. And so for young people to be inspired by this really means the world to me.
She really, I have to give her a lot of credit too, because at age 11 or so, she really took on the program you had suggested and was extremely disciplined, more so than any 11-year-old I've ever seen, certainly more so than I am now. And she still is very, very disciplined about what she eats. And you can tell it makes a difference for her because every once in a while she'll have something she shouldn't have just because she likes it, and she says she really notices how she feels. Yeah, it really impacts her. So so thank you.
Thank you. I mean, I'm grateful because I want our patients, young and old, whoever it is, to really be aware of their body, how it reacts to things that we put in it, how it reacts to things that we say, how it reacts to replacing hormones, especially as we age. And she's just young; she doesn't need any of that stuff. But it's very inspiring to me because when I was her age, I didn't have access to any of this. I didn't even know this. This field didn't exist, actually.
Right.
I was the first graduating class from SCNM. That was 1996. So you and Carrie now, both of you come for your hormones. And one delivery method that Craig chose is he does the pellets. So I see him every 3 to 4 months, and we give him his testosterone. It's a very convenient way to take testosterone. And that's the only way I'll see my men more than once a year is if they're doing their pellets. So tell us about the hormones and how they've changed the way you feel.
Well, I think that they definitely impact my energy level. I recently turned 60, and so I think that, you notice as you get older, just general sort of energy and function, even when you exercise and do what you're supposed to. So I do feel like it makes a difference.
Yeah, it definitely does. And I know with Craig, one thing that happened was he didn't come for a while, so he was very depleted. And then we did it again pretty quickly just to make sure he doesn't run out. And that's when I think you noticed it the most.
I really noticed it then. I'd been so consistent for a long time. I didn't really feel any different. It was, sort of the leap of faith. But I think it was last fall that I went longer than I should have. And I definitely noticed the difference.
Yeah. And especially when it comes to the pellets, I learned from a patient years ago, she's moved away to California, but she was waiting for me in the pellet room one day and I was a little bit late and she said, plug me in, I'm late. And that's the first time I ever thought of hormones as batteries to our system. And that's really what they are to me in my brain is they're the batteries that turn our cells on. And as a result, we feel and function better and we reduce our aging risks. And so Craig was here to help us, just share with you how his whole family kind of looks at functional medicine. I believe, do you go to a primary care doctor as well? Like, does your family have a primary care
I
doctor?
did, and he retired, so not anymore.
Right.
I don't think it's necessary.
Yeah. And Carrie, your wife comes here. She does a lot with us. I don't think she's got a primary care anymore either. But that's kind of how it goes. Some of my patients, I'm their primary care. Others, I'm just their hormone specialist. It just depends on each patient. Is there anything else you wanted to share before we close?
I can't say enough about how pleased we are with the services you provide and what you've done for us, and a number of, everybody going through life runs into medical challenges here and there, and we've had a few in our family. I've had a couple in the last 10 years. I mean, nothing terribly major, but something in both cases, things that were a bit unusual that you definitely helped with, and I don't think a traditional Western MD probably would have figured out.
And it's true. In conventional medicine, they're not trained to prevent. They're more reactive. We're proactive. And so it's a completely different approach. And as a family, they appreciate, what we can help with: nutrition, maybe some exercise, maybe we're helping with their joint pain. Whatever it is, we come from it from a different perspective. And that's what Craig and his family appreciate. Thank you so much for taking your time out again today.
Thank you. My
pleasure. I know
pleasure.
you're really busy, but it's nice for you to share the word, to help people understand, what this means to come to a functional medicine doctor. So have a great day, Craig, and the rest of you have a great week, and we'll see you next week. Thank you so much for joining us. Bye-bye.
Thank you for joining us, and stay tuned for our episode next Tuesday. Stay healthy and happy. Until next time.